So things that you may encounter during treatments with the medications, and we try to really minimize this in our clinic. We're very conservative in starting where we're starting you and how fast we're going up. But this does happen, right? Nausea, vomiting mainly happens in the beginning of the treatment. Probably have 2 out of 50 patients who experience this, and it's very unfortunate. This goes away as long as we don't push ourselves too much. A lot of time with the next dose, I have to either lower it or keep it at the same level. Diarrhea, constipations. Fortunately, we don't have any patients who have very bad symptoms in our program. And that's partly, I think, diarrhea and constipations. And you think, why would somebody have diarrhea and the other have constipations? It's everybody just respond to everything differently, right? Some people tan, some people burn. So these symptoms are heavily dose dependent, and most occurred at a higher dose, above 1 milligram, right? So if your happy dose is at 1 milligram or less, the chances of you experiencing this is very, very low. Dehydration. Fortunately, we don't have anyone with major dehydration, but this is what can send people to the hospital. So it's very, very important. Myself, Helen, constantly emphasize that you have to hydrate, stay hydrated, especially during the beginning of the treatment. Tiredness, low energy level. This really happen when we go up on the dosage and it's a little bit too much for you. The increase is a little bit too much. Again, really rarely happen. I would say, 3 patients have reported this to us. But when it happens, usually short, time limited, maybe a day after you feel normal again. And we just need to be cautious with the next dose so that it doesn't happen again. Plateau, we mentioned already, and how to combat it. And then the infamous or famous Ozempic face and Ozempic butt. Everybody's talking about it. Yes, I think if we lose anybody, if we lose weight, if we lose a lot of weight and we lose it very quickly, we will have deflation in our face, deflations in our body, maybe to the point where we feel like we need to have surgeries or stop losing, right? There is a lag between weight change and how your skin respond to it. So when I first started, within a month, I lost 6 pounds, and it showed in my face. But after 1 month passed, my face returned back to normal, and I actually like my face now more than before I lost the weight. Granted, I'm a plastic surgeon. I started minimally invasive skin treatments since I was in my mid-30s. So I'm maintaining a lot of that collagen. And we all can do that, right? The volume loss in the breast and the butt, not all can be corrected with just exercise. And we can talk about options, solutions, right? If that does occur and you want to stay in that weight, but you want fuller breasts or fuller butt.